Hello everyone, I welcome you all to my video once again. I have been treating asthma as a medical condition with you, okay? But in this particular video, I'll be educating you on hypertensive disorders in pregnancy. So hypertension in pregnancy is a blood pressure with a systolic BP of greater or equal to 140 and a diastolic BP of greater or equal to 90 degrees. At any gestation measured on two separate occasions more than 4 hours apart. We also say if the BP is severe, that is systolic BP of greater or equal to 160 and a diastolic BP of greater or equal to 110, then the BP should be confirmed within 15 minutes. In this confirmation of this BP within 15 minutes, we prefer to use the calibrated sphygmomanometer in the confirmation of this BP. Okay, let me also mention to you some of the classification of the hypertensive in pregnancy. So some of the classification you may know, we have hypertension known before pregnancy or present in the first 20 weeks of pregnancy. So when we take out this particular one, we have underage chronic hypertension. And this chronic hypertension is pre-existing hypertension diagnosed before 20 weeks of pregnancy. That is 20 to 25% risk of what progress towards preeclampsia. 20 to 25% risk of progression to preeclampsia. So we also have white coat hypertension, and the white coat hypertension refers to the elevated office BP with systolic 140 on 90, but normal BP measure at home or at work. We also have maxed hypertension, and then the maxed hypertension refers to the BP that is normal at office, okay? BP that is normal at office visit but elevated at other times, most typically diagnosed by 24 hours ambulatory BP monitoring or automated home BP monitoring. I hope you are enjoying my teaching. Okay, so all this video about the previous topic I've treated with you, with this particular one I'm introducing. If you are somebody who haven't seen the previous one, you can just go back to watch all my other videos. But don't forget, all this video, you find some of them on my pages and then my channel. I have YouTube channel, Justine Esnam, and then Facebook page, Justine Esnam Awudi, and then on TikTok, Justine Esnam 4. So I'm still on the classification. I mentioned to you what hypertensive known before pregnancy. So the second classification, we have hypertension arising as new onset at or after 20 weeks of pregnancy. And under this hypertension arising as new onset, we have under it transient gestational hypertension, and this transient gestational hypertension refers to a new onset of hypertension that develops at any gestational age and resolved without treatment during pregnancy. That is the transient gestational hypertension. Then we also have preeclampsia, and this particular one refers to the new onset of hypertension or the new onset of hypertension complicated by a proteinuria of end organ dysfunction after 20 weeks gestation and frequently near term. So the last one under the hypertension arising as new onset, we have gestational hypertension. And then the gestational hypertension refers to a persistent new onset of hypertension that develops after 20 weeks gestation in the absence of what? Features of what? Preeclampsia. Don't forget you are watching a video on hypertensive disorders in pregnancy. I just spoke to you about hypertension in pregnancy, after which I mentioned some classifications of what hypertension in pregnancy. I think you have not finished enjoying the video because this is not all about hypertensive disorders in pregnancy. There are more I'll be bringing to you. But then, when you finish watching my video, kindly share, subscribe to my channel, and then also like. Until then, I'll meet you in the other video. Have a good day.